Hey guys, Jamie. Welcome back to Abdominal Sonography Registry Review. Feel free to pause the video after I ask the question. Give enough time to answer it before I answer it. Let's dive back into this thing. Question 101. Which is not associated with this ultrasound? A. Nephrotic syndrome. B. Conn syndrome. C. Cushing's disease. Or D. Hirsutism. The answer is A. Nephrotic syndrome. And this patient has adrenal adenomas, which is associated with Conn syndrome, Cushing's disease, and hirsutism. Question 102. Drag and drop the letter X where mucoepidermoid carcinoma most commonly starts. So where would you put this X? This type of carcinoma typically starts growing in the parotid gland, and the parotid gland is right here. So you'll just place your X right there. Question 103. Which is true about this finding? A. Usually found in the left hepatic lobe. B. Causes right upper quadrant pain. C. Most common benign liver tumor. Or is it D. Can be identified with enhancement artifacts? The answer is C. This is the most common benign liver tumor, which is called a cavernous hemangioma. Question 104. This condition will have elevated levels of what? A. HCG. B. LDH. C. AST. Or D. AFP. The answer is AFP, which is elevated in patients with non-seminous tumors. Question 105. Which will most likely be the direct result of OCPs? A. Cavernous hemangioma. B. Hepatic lipoma. C. Hydatid cyst. Or D. Hepatic adenoma. OCP stands for oral contraceptive pills, which help prevent pregnancy. These can be the direct result of hepatic adenoma, so D is the correct answer. Question 106. Where is this kidney cyst located? A. Renal pelvis. B. Renal cortex. C. Major calyx. Or D. Renal sinus. The answer is B, renal cortex. Question 107. Which is not a hyperechoic mass on ultrasound? A, hepatic lipoma, B, hemangioma, C, focal fatty infiltration, or D, hepatic lymphoma? The answer is D, hepatic lymphoma. And this type of tumor is actually hypoechoic. Question 108. Click in the area where scrotal pairs frequently originate from. The answer is right in this region here. This is called the tunica vaginalis, which is well seen here and up here. Question 109. Which is not related to glycogen storage disease? A, fatty infiltration, B, von Gierk's disease, C, hepatitis, or D, hepatic adenoma? This can also be pronounced as von Gierk's disease or von Gierk disease. The answer is C, hepatitis. Question 110. Which sonographic appearance of cirrhosis can indicate the acute phase? A, fatty infiltration, B, liver atrophy, C, hepatomegaly, or D, regenerative nodules? The answer is C, hepatomegaly. Question 111. This patient will have increased levels of what? A, ALT, B, AST, C, ACTH, or is it D, AFP? This patient has an adrenal adenoma, which will increase your ACTH. So C is the correct answer. Question 112. Which of the following does not secrete catecholamines? A, adrenal neuroblastoma, B, pheochromocytoma, C, myelolipoma, or is it D, paraganglioma? The answer is C, myelolipoma. Question 113. Which is associated with the propagational speed error artifact? A, hemorrhagic cyst, B, portal vein gas, C, candidiasis, or is it D, myelolipoma? The answer is D, myelolipoma. This is because this type of tumor contains fat in it, and any type of tumor that contains fat will cause speed error artifacts. Question 114. Which of the following can you expect to see secreted from this pathology? A, norepinephrine, B, cortisol, C, dopamine, or D, medinephrine? This type of tumor represents a pheochromocytoma, which will actually increase the levels of secretions of norepinephrine. Question 115. In this image of the kidney, what is the arrow pointing to? A, polycystic kidney, B, multicystic kidney, C, neuroblastoma, or is it D, cavernous hemangioma? The answer is C, neuroblastoma. Question 116. The leading cause of cirrhosis is what? A, alcohol, B, genetics, C, hepatitis C, or D, obesity? The answer is C, hepatitis, which used to be alcohol. Question 117. What can help enhance bladder jets in the presence of hydronephrosis? A, power Doppler, B, 3D color, C, Valsalva maneuver, or D, increased PRF on color Doppler? The answer is A, power Doppler. Question 118. This video is associated with what? A, mitochondrial disease, B, metabolic syndrome, C, Budd-Chiari syndrome, or D, Conn syndrome? This ultrasound represents hepatic steatosis, which is associated with metabolic syndrome. Question 119. Which is the most common liver disorder in the Western world? A, cirrhosis, B, alcoholic fatty liver, C, non-alcoholic fatty liver, or D, hepatitis? The answer is C, non-alcoholic fatty liver. Question 120. Which is not associated with glycogen storage disease? A, fatty infiltration, B, focal nodular hyperplasia, C. Hepatic adenoma, or D. Hepatosplenomegaly? The answer is B. Focal nodular hyperplasia, or FNH. Question 121. Click in the area where hydrocele originate from. The answer is the tunica vaginalis, which is well seen here and here. Question 122. Which is not caused by a tuberculosis infection? A. Chronic renal failure. B. Granulomas. C. Adenomyomatosis. Or D. Addison's disease? The answer is C. Adenomyomatosis. Question 123. In the sagittal view, where on the sector is closest to the patient's inferior? A, B, C, or D? The answer is D in this region here. This is the anterior part of the patient, posterior part of the patient, superior portion of the patient, or towards the head. And this is towards the inferior portion of the patient, or towards the feet. Question 124. Which is not a form of hepatic abscess? A. Pyogenic. B. Amoebic. C. Hydatid. Or D. Fungal? The answer is C. Hydatid. Question 125. In this image of the kidney, what is the arrow pointing to? A. Polycystic kidney. B. Multicystic kidney. C. Neuroblastoma. Or D. Adrenal adenoma? The answer is C. Neuroblastoma. And that concludes all the questions for this test. I'll hurry and write 25 more questions and upload that video as fast as I can. If any of you have any questions about your upcoming abdominal sonography boards, feel free to email me at ultrasoundboardreview@gmail.com, or you can proceed text or call at 435-922-1635. If you're looking to purchase mock exams, you can subscribe to our abdominal sonography study material at ultrasoundboardreview.com. I'm Jim with ultrasoundboardreview.com. We'll see you next time.